Throughout my life, I have been told by others that I am often one who dares to be different. I'll use this platform to stay true to that reputation and provide you with a not so typical way of viewing the back of my resume. This is me, Katie O'Bright. You've probably already had a minute to look at my CV and perhaps read through my essay, so I won't spend too much time reviewing my professional profile. This presentation is for you to get to know me as Katie, a wife, mom, and person who is generally curious about everything. I was born and raised in the greatest city in America, Buffalo, New York. I am, unfortunately, a Buffalo Bills fan. I am confident that we will someday rise to glory. I was raised by two of the most wonderful people in the world, in a big Irish family. I went to an all-girls Catholic high school where I was a fairly successful rower. I went on to the University at Buffalo to complete my undergraduate degree in exercise science. During that time, I was also a contracted Army ROTC cadet. I graduated and commissioned in 2011 and packed my bags for Philadelphia, where I spent the next 3 years working on my DPT at Temple. After that, I went into the active Army, where I served for 4 years as a physical therapist in Fort Sill, Oklahoma. This is my husband, Ben, and my two sons, Hunter and Jimmy. My husband was an infantry officer and ranger in the 10th Mountain Division, then transitioned out into the oil and gas industry. We met in Fort Drum, New York, where he was stationed and where I was doing my second clinical rotation. This was our first picture together. It was July in Atlantic City, and the water was unseasonably freezing. My relationship with my husband is one of tremendous love, but also of mutual respect and admiration. We share household roles equally and discuss everything openly. We share the desire to better ourselves and often read leadership books together. We made the decision to expand our family with the understanding that we would always put each other first, regardless of life circumstances. Having children has changed my life drastically, and definitely for the better. My two sons, Hunter and Jimmy, are my world. Raising young kids is challenging sometimes, but it is also incredibly fun, rewarding, and hilarious. My 2-year-old Hunter is the silliest little boy. Around Halloween this year, he demanded to go to sleep every night with one of our pumpkins. He loves momos, or lawnmowers, and particularly enjoys picking the mushrooms out of our lawn. Our baby, Jimmy, is the happiest kid and always has a smile that lights up any room. He just started crawling and is getting into everything. My family will always come first and truly is the greatest part of my story. I love to travel and was fortunate enough to get some traveling done before I had kids. I spent my last DPT clinical rotation at Landstuhl Regional Medical Center in Germany and traveled all over Europe. I spent a few days in the Alps in Austria, walked through the Gaudi Cathedral in Barcelona, saw the Eiffel Tower at night, sailed down a river in my grandparents' hometown in Ireland, and drank a Hefeweizen or two in the Hofbrauhaus in Munich. I culminated my DPT graduation with a trip to the Dominican Republic. But I would have to say, out of all my trips, there were none that compared to my experience in India. I loved India. I traveled there on our cultural immersion trip as an Army ROTC cadet. I have a passion for humanitarian work and would love to go back someday in the future. I love being outside. In fact, it is a big part of my family life. My husband and I often go hiking on the weekends and take every chance we get to be outside with our boys. We love all 4 seasons, and I could be outside in any of them. My dream is to one day open a clinic where I can be outside all day long. Although I doubt it would ever pass a Joint Commission inspection, one can dream. We have a 4-year-old chocolate lab, Daisy, that my husband trained to be a duck retriever. She's not your typical working dog, however. She's pretty spoiled at home and enjoys sleeping in our bed under the covers. I had a lot of great experiences as a service member. I had the chance to jump out of planes at airborne school, rappel down buildings, and fire some very cool weapons. But the majority of my Army experience was spent indoors, learning how to be a PT and developing my leadership skills. I credit much of my current orthopedic competence and understanding to being surrounded by other clinicians who truly appreciated critical inquiry and discussion. I will always be grateful for my military experience, but I felt a calling to pursue other areas of practice. A very unique patient that I worked with while on active duty made me curious about oncology care. That landed me a job at the University of Oklahoma's Stevenson Cancer Center. In the span of a few months, I have become aware of just how uninformed I was about cancer and the effects that it can have on the orthopedic system. Not only do I love working with these patients, but this experience has truly enhanced my critical thinking skills when it comes to complex medical issues. Bonus points for anyone who knows what the arrows are pointing to in this picture. When I think about my future, I think about being in a position where I know that I can grow and learn, both personally and professionally. I feel that the Duke community would serve me and my family very well. I feel that fellowship is truly the right next step for me to continue my lifelong learning journey.